the Pet Health and Happiness podcast from Bella+Duke, keeping you at the cutting edge of pet nutrition, behaviour and health with expert interviews, mythbusters and more to help your pet lead a healthier, happier life.
Okay, everybody, welcome to this week's episode. My name is Rowan Sanderson and I'm the CNO here at Bella+Duke. Have I got it the right way around this week? Yes, first time. And I'm with Dr. Brendan Clark of the RFVS, who is the president thereof of the Raw Feeding Veterinary Society. Please check them out and go and give them your support. And in this episode, we are going to cover dog obesity. What is it? What you need to know? What are the symptoms associated with it? And how to deal with it? It's a huge problem. Dr. Brendan, welcome.
Hi there. Thanks for having me.
Oh, Brendan. There's a rumor out there that nobody can have you. Dr. Brendan, thanks for coming on. Let's dive straight in here. There is a difference between being slightly overweight, which for instance, growing puppies might be beneficial, and being overweight and obese. How would you differentiate between overweight and obese?
Okay, so it's one of the biggest health crises that's happening across the human sphere, but also actually the dog sphere. We see it certainly in the Western world. It's a huge impact on canine health, and it's really based around looking at the diseases that obesity can cause. And so there's a few sources that you can find for working out where your dog sits on the weight scale. And it's not about how much they weigh as much as what their body condition score is. This is a way that for years we have looked at animals' general fat covering.
Okay, I'm going to just quickly jump in here because with your very good self previously, we've covered the body condition scoring and how to work it out. And we'll put a link in the show notes so that people can do this at home with their pets if they have any concerns. Thank you, Brendan.
Great. So brief resumption of that is that the body condition score is usually a scale of 1 to 5 or 1 to 9, and plumb in the middle of that score is ideal weight. Below is going underweight, above is going overweight.
Okay.
We will often see that look at that method of scoring, and it's judging at what point is your dog, if it's a 3 or a 5, depending on the scale that you use. Let's use to 5 because it's easier for me. So if 3 is ideal, you get to sort of 4, you've started to lose their waist, they've started to flatten off under their tummy, they've started, rather than going up into the groin, they've started to lose definition of the ribs. Very simply, more detail in the other podcast. When you start to get to 5, that truly is obesity. We see dogs regularly into the practice who are 5++. Okay, they're not even on the scale. They have so much fat around their rib cage, and you can't see. They're like a coffee table on legs. With a leg in each corner, and you can rest a pint pot. I wouldn't advise doing that on their backs, and they're flat as anything. That is just too much weight for their joints, for their breathing, their health. We see this on the outside. You've got to remember all of that's going on the inside too.
Right. So this is a really good point. And in fact, I was walking on the beach only the other day and I saw a poor dog which had got into that condition, and it was literally the same width all the way along its body with these points as you lovingly describe as a coffee table. But that's a really easy way to see when your dog's waist doesn't go up into the groin area. Wow. the impact that has on that dog's life and its ability to run around and be pain-free and to be joyful is incredible. So at this point, I think we should jump into clearly one of the symptoms of being overweight, obese is carrying all this excess body fat. What are the other things associated with obesity that we need to take seriously?
So the things that we see, obviously, lameness, the joint disease, that's fairly evident. You start to see dogs slowing down. You can imagine if you're wearing a rucksack that weighs the same as you on your back, it's going to have wear and tear issues. But we also see respiratory problems, the amount of fat that's inside their chests, them overheating in the summertime, having more respiratory disease because they can't exchange oxygen properly. There's fat inside their chest. But then we go into all sorts of other problems with their organs in their abdomen. Okay, so below the diaphragm, you might see issues with liver, particularly. Getting extra infusions of fat that makes it less able to cope when it's have an influx of jobs to do, detoxifying the system, etc. And it's something that we do need to be a little bit careful of. If you suddenly reduce their fat by reducing their diet dramatically, they can actually mobilize fat in their body, and that can actually accumulate more so in the liver and actually accentuate the problem for the liver. So that's something called fatty liver syndrome.
Okay, now this is quite interesting, isn't it? Because one of the primary drivers, and I want to continue with symptoms, but one of the primary drivers of obesity is clearly sugar, and we'll come to that in another moment. But ultimately, sugar is in itself is known as a hepatotoxin, as in it can create inflammation and problems in the liver, which is we all call the grandfather organ because it's so important. It's got such a key role to all the other organs. It makes me think of Morgan Spurlock in Super Size Me, where in the space of a month, he managed to give himself fatty liver disease, the precursors to it, and he wasn't even drinking alcohol. So that's something to take super seriously. This kind of obesity has a huge impact on your liver. Okay, so we've covered just very briefly what obesity is, what the symptoms are, and what are the things associated with it, apart from the things we've mentioned so far, which are obviously joint diseases, obviously that precursor for arthritis, respiratory issues, and of course, liver issues. Are there other things associated with obesity, Brendan?
So we will think about metabolic diseases, things like diabetes, obviously start to come in to play. That's maybe a little bit complex for another day, but it is one of those diseases to look at there. I think some of the circulatory things we need to discuss because we need to put things to rights here. Unlike humans who drink excessive amounts of wine and smoke and do all of those things in certain situations.
How dare you?
Then what we end up with is actually damage occurring to the vessels that for our circulation. Okay, and then it is the cholesterols within the system that patch that damage and cause the infarcts. And so you've got to understand that when we're talking about circulatory triglycerides, that's the fats that are in the bloodstream, cholesterol being within those as well, that you end up getting concerned clients saying, well, is this going to lead to heart attacks and arterial disease and infarcts that we'd get in people? We don't normally see this in dogs. The circulatory issue is more to do with constriction of vessels because of excess fat around them. It's harder to pump blood through all of that excess tissue, not because you've got infarcts inside the vessels, because your dog does not smoke and drink as much unless you've closed them in a room and they're getting secondhand smoking situations.
Okay, cool. Understood. That's a really good differentiation to make. Anything else? I know this is a very contentious point whenever you mention the C word. I am not giving a medical opinion here. I have seen repeatedly that there is a higher correlation, according to most research, between obesity and cancer, and that scans in the human world as well as the dog world. And to me, as a non-vet, but just simply as a clinical nutritionist, that does make sense. Why? Because inflammation is associated with cancer, and we know that obesity is associated with inflammation. So it's hardly a huge step to make. Am I saying it causes it? No.
Well, I can definitely say that there is a paper from about 2004 done on the correlation between obesity and cancer.
Okay.
You know, the science is out there. It is contentious in some respects because people will talk, therefore, is that one of the reasons that neutering can become a predisposition to cancer, because those animals tend to be more likely to be obese in later life. But there are so many other things to do with what we feed, generally, what we feed the population of pets as to why they are becoming obese. You know, there's a few of the guidances on nutrition and nutritional values to calories that maybe are archaic and have been abused to a level that is letting our pet population, unfortunately, become obese in order to try and fit them into the average of what an animal should obtain from their diets.
Okay, well, those are really good points. It's funny you talk about averages. We had a saying in our human clinic that basically normal blood tests are not enough. And that is because if you actually try and put yourself in the middle of the demographic of people who are being tested, you're putting yourself in the middle of a sick population, because by definition, the people who are getting tested are all kind of ill or have symptoms. So there's a difference between optimum and normal.
Yeah. And, you know, so important to think about getting some baseline bloods done on a young, fit, healthy pet, so that you can trace where their bloods are going as they get older. So speak to your vet about that, rather than trying to think that you should be just testing them one-off in later life and hoping that they fit into the normal bell-shaped curve of the population.
Well, I guess ultimately as well is, if we go back to base on this, simply by monitoring your dog's condition score, which is really simple. Once again, we'll put a link down here. You're pretty much avoiding most of these symptoms, aren't you?
Yeah, absolutely.
It's really that simple. All of the reason we're covering this in the podcast is, I think it was you told me an incredible stat the other day. It was something like 46% of the population of dogs in the UK are deemed to be overweight or obese. I think you mentioned that so many of them coming through your surgery doors, which by definition generally aren't just checkups, they have symptoms, are overweight, and that this is the key to all of these other, or a major part in the jigsaw to all of these other symptomatologies and downstream problems such as joint disease and respiratory disease.
And that's the devastating thing, is people think the 46% is obese, okay, as that's just overweight dogs. Well, actually, the stats for overweight dogs, I think there's a few reviews in America, is actually 80% are overweight, okay? So that's a huge number. That is why we talk about it as the obesity crisis. It is the biggest disease, that's dis-ease, that is occurring in Western culture at this point in time.
And we can all address this. We've covered most of the big issues associated with obesity, apart from excess body fat. What would be your number one recommendation to anybody with an obese dog? What's the first thing they can do to address that proactively?
Okay, so you've got to think about setting a goal that is not super unrealistic. You want to be thinking, look, if your dog is on a body condition score of 4 or 5, well, if it's on a body condition score of 4, so just overweight, then you should be setting yourself 12 weeks, that's 3 months, to try and affect that and get it back to a norm. If you're at a 5, that could be 6 to 12 months. Don't be unrealistic. Don't do the crash dieting for your dog. That's number one. Number two, absolutely. Look, you mentioned earlier about the excessive carbs actually being responsible for sugars, particularly for the obesity crisis. And I think if you're out there and you treat your pet, just think about using something that is not going to be carb loaded. Okay, look at, there's plenty of jerky treats, dried meats, that you can use. There's plenty of other protein meats that you can use, that side of things. And consider raw. Raw is great. I definitely would say all of the cases that I speak to that have obesity issues are moving off carb-based diets onto raw protein and fats-based diets. Okay, it's not about low fats here. This is about making it more species appropriate, biologically digestible and metabolizable, so that they can actually do things normally with their metabolism and then start to lose the weight.
And this is key, actually, because I interviewed Dr. Barbara Royal of Pet Food fame a couple of weeks ago, and she said, obesity, it's all about the carbs. And when we step back from it, dogs are carnivores. They have one means of lowering blood sugar, but they've got 7 ways of chemically raising blood sugar, which tells you instantly that they're not used to having carbohydrates in their diet. It's quite clear. Now, here's a shocking stat for you, or rather really positive and hopeful one. We recently did a survey in our group, our Facebook group, and there's now over 15,000 people. So kudos everyone for taking part. And I think there was just over 3,000 respondees. 86% of people reported an improvement in their dog's body composition score simply by switching to raw without changing anything else. I mean, that is, what more do you need?
Absolutely. Those are the things that, big drivers for why we're talking about species appropriate diets and moving them across to raw foods.
And I guess this is one thing that people need to understand is, I understand the conveniences of highly processed food. I understand that it's convenient as an owner. However, to actually create that, you need a minimum of something like 35% carbohydrates to be able to bake all the other bits together, to glue it together and go through that process. That is just biochemically simply too much for a dog or a cat, in my opinion. And is at the root cause of these obesity issues. But that's my opinion. So, Brendan, we've got set a realistic target, switch to raw. What would be your number 3?
Just look at, how you are feeding those pets. Who in the family is coming to visit, what sort of like the extras are going in. I often will find that, where we've got a case which is sticking, it is that we sit down and we talk to the family, not just the one person that's coming into the surgery, And we often find that Uncle Joe is coming in, visits on Wednesdays for breakfast, and all of a sudden, 3 slices of toast, a couple of chocolate biscuits, and a number of other treats are going under the table to the dog, who adores him. And so therefore he continues to misbehave and give those things. So please, please, please check with the whole family, however sweet it may be. If you're trying to lose weight off your dog, check what treats you're using, who's using them, how they're being used. Okay. I think that's probably...
It's a simple one, but it's critical, because if you're doing all the hard work and being vigilant, and somebody's coming into the home and confusing love with food, however well-intentioned, it could unravel a whole week's worth of work. Difficult for me to say today. Very quickly.
And I think, think about the fact that actually, 5 minutes of grooming, brushing through your dog, of actually paying them attention, is going to be worth, 1,000 calories as far as treats in the same endorphin release that you're going to give your pet. So why on earth aren't you grooming them, giving them the attention, physically doing that, rather than actually just trying to, give them a treat reward instead? So please consider that as a definite benefit for both of you if you're going to want to reward your pet.
I'm going to do that immediately after this podcast. Is there anything else we should be considering? Shall we touch in on exercise? Because this is a bit of a two-edged sword, isn't it? If your dog is overweight.
So that is my number 4, and I it's down at number 4 purely and simply because for many of these patients, they are obese, and that actually, as we've talked about earlier, puts a load on their joints. And if you stretch into exercise and increasing exercise too quickly, you can actually do more damage than good, hence the two-edged sword. There are a couple of options out there, of course, and hydrotherapy is a great one. So, if your dogs enjoy swimming and there's a hydrotherapy center near you, at least have a trial run with them, get to talk to them about why you're going and looking at losing weight, and set yourself a goal. And that can be really useful, non-load bearing exercise. And can be really, don't worry about the time limits. People say, well, it's only 10 minutes. Well, actually, do you know what? A 4-minute swim is probably worth easily a 20 to 30 minute run around the park. Okay. So just in the energy expended. So I would just say, please think, go for hydrotherapy. Great way for those dogs that really finding it hard to shift and need exercise. But for other dogs, a gradual period of increasing exercise. You can't just not exercise them, but just gradually, building that exercise, 5 minutes a week extra each day, and just sort of like, on a weekly basis, increasing that so that you are getting them back to being able to cover more distance. And remember, work the brain. Don't just work the muscles, okay? Brains take energy too. So if you can really start to do some of the grooming stuff that I talked about, but also the training, okay? The endorphins are great for them. The reward that they get out of that is brilliant. But actually, the engagement that you're creating with them also is going to be burning calories. So all of that is really, really useful ways to get that weight down.
Yeah, that's really good. This resonates with me. Kismet, who is absolutely, and thanks for all your fabulous help with us. She's very appreciative. She's writing you a note as we speak. She loves to run around, would run around till her heart pops. So quite often I take her to the ocean just to take some of that load off there and keep her engaged. And one of her favorite games is to actually go and find something in the garden. But you can see her smiling. She's utterly animated. And rather than just running around constantly chasing a ball, She's actually engaging her brain. And you see that really is tiring. You know, when you've hidden something at the back of the garden, for her to go around and sniff around, that's using all of their superpowers and is massively metabolically uplifting, shall we say. Okay,
Great.
so we've covered exercise. Is there anything else?
So there are some supplements out there that people will consider to try and increase their metabolism, and I think you're probably well placed to start talking about some of those out there. Just be careful of the fads, okay? You know, we go through fad phases of, you know, everything from coconut oil can cure everything to you know, turmeric's just, you know, the next thing, you know, best thing since sliced bread. You know, just be cautious. If it can start to cure all, then maybe all of the claims that it's making isn't quite what it says on the tin. So do seek your veterinary advice. You know, if you're really struggling, there are some medications even out there that have been advocated for dogs losing weight. And I think, you know, engage with your health professionals. Your nursing team at your vets are going to be excellent at helping you through that weight loss program. I'm sure there's loads of other nutritionists that are out there too, your hydrotherapy. You know, just think about, there's loads of people out there to help you. This is not something you're on your own with. Even if you engage with the community on Bella+Duke, there'll be loads of people being able to give hints and tips as to how to improve that weight loss. But I think try and do it with everybody else. Don't try and do it alone.
Yeah, that's so much better. It's a lot more fun, isn't it? You get to share tips, you get support, you get to enjoy a bit of humor and some banter and realize that this is a very common issue and it's very easy to change and you can enjoy the whole journey. I'm going to avoid going into the supplements thing just because I would love for people to focus on the bigger wins. I think there's probably 90% of the marks there. One little tip that I really like is when the dog is rolling in terms of the starting to lose weight, is just to actually maybe drop a meal once a week and do some intermittent fasting. But I kind of avoid that when the dog is very overweight because I would like them to avoid dropping weight very quickly. But I think, you know, all the points really resonate here, which are basically, just to recap. Firstly, set realistic targets. Secondly, to feed raw, which is naturally low in carbohydrates and will bring so many big wins and give them all the nutrients they require to actually help them in the fat loss journey. Thirdly, remind me here, Brendan.
So thirdly, you're going to be looking at reducing the treats of the family coming in.
Exactly.
And, you know, starting to disrupt your weight loss plan.
Yeah, absolutely. Make sure you've got the whole family, the whole tribe on board. Fourthly, exercise, hydrotherapy where you can, and actually gently increasing it. Your point of increasing 5 minutes per day over the, you know, per week, never underestimate. That's 35 minutes more each week. Over the weeks, that really accumulates. I think that's a really potent one, and especially engaging your dog's brain is a great one. And then maybe throwing some intermittent fasting when you've started to go. I think realistically, if that doesn't work, we've really got to readdress some fundamental underlying issues. But I think that's going to work for 99.9% of dogs out there. Would you agree, Brandon?
Yeah, absolutely. And also, you know, engaging with your health professionals, you know, if there is an underlying issue, thyroid, whatever it is that's causing that problem, they can be on it to detect that if there's persistent problems with lack of weight loss.
Perfect. Well, Brendan, I think we've covered it there. Maybe we'll come back to this when we get feedback from it. For all of you guys who enjoyed this episode, please leave feedback. Please give us a 5-star review if you feel we're worthy of it on Apple, on iTunes, and come and join our brilliant Facebook community, Bella+Duke, the Raw Feeding Pack. you're welcome. We're here to support you, whether it's in weight loss, whether it's dealing with other issues, or if it's simply transitioning to raw. No question is a daft question. We've all started, and why try to invent something which everybody can really help you with? You're welcome. Brendan, thank you for your time and your insights, as ever. Inspirational. It's always a pleasure. I learn something every week. So thank you.
It's great, guys. See you soon.